When is the best time to sign up for Medicare? If you are turning 65 or you are currently in a Medicare plan and you're not sure how to get the best plan that you deserve, this video is for you. You may also know that there are penalties that come with not signing up for the right Medicare plan. Those penalties could last a lifetime. And if you are turning 65, you are probably being bombarded with Medicare ads and you're not really sure what is true, what is fact, and what is not. I am going to explain to you the best time to enroll in Medicare and the facts that you need to know in order to get the best value for your money. I am Kwame Kwade. I am a personal finance and government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I am also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the country. Now, if you're new here, we really appreciate you being here. If you like what you hear, hit the like button, hit the subscribe button, and most importantly, I want to know where you're watching this broadcast from. So do me a favor, go into the comment section, let me know your city and your state. So let's dive in. Medicare 2025 and what you need to know in order to maximize your benefits. The first thing you need to know is that missing Medicare enrollment periods can result in lifelong penalties and coverage gaps. It is essential to be aware of the dates to avoid unnecessary financial burdens. Now, late enrollment may increase your premiums by at least 10% for every 12-month delay. This penalty is permanent and can significantly raise your healthcare costs over time. Now, the number of employees at your workplace determines your Medicare requirements after 65. Understanding your employer's classification helps you make informed decisions about when to enroll. And even if you feel really good and healthy, planning ahead prevents unexpected costs, especially when it comes to Medicare. Now, there are very unique windows that you need to pay attention to. The first one is the initial enrollment period. That is a 7th-month period if you're turning 65, where you need to sign up for Medicare. This period starts 3 months before and ends 3 months after your birthday month. And then there's the special enrollment period, available only if you delay Medicare due to active large group employer coverage. This allows you to enroll without penalties after leaving your employer plan. And then there's general enrollment period for those who missed IEP and SEP. It runs January 1st to March 31st annually. Coverage begins later in the year and penalties may apply. So missing IEP and SEP can lead to higher premiums during the general enrollment period. It is important to understand these periods to avoid lifelong costs. So let's talk about employer size before we get into the details of those open windows. Defined as 19 or fewer employees, that's a small group employer, Medicare becomes your primary insurance at 65. If you do not enroll, your claims may not be paid by your employer's insurance. Now, large group employers are 20 or more employees. You may delay Medicare without penalty if you're covered. This distinction allows you to keep your employer insurance as your primary insurance while you work. Small groups or small employees are not required to provide Medicare eligible coverage. Relying solely on a small group insurance after 65 can leave you exposed to denied claims. Not enrolling in Medicare with a small employer may lead to denied insurance claim. Insurers can refuse to pay the portion Medicare would have covered if you had gotten the right information and enrolled during the right period. So let's talk about the initial enrollment period. It starts 3 months before and ends 3 months after your 65th birthday month. So if your birthday month is April, your period starts January, February, and March. April is your birth month, that's the 4th, and then May, June, July. So you have January to July if your birth month is your 61st birth month is April. So that's the way to think about it. If you're already receiving Social Security, you are automatically enrolled in Medicare Part A and Part B. You will receive your Medicare card by mail before your 65th birthday. If not receiving Social Security, you must proactively apply for Medicare. This process is simple and can be done online or in person. Basically, if you're delaying Social Security, when you hit 65, you still have to apply for Medicare if you are not being covered by your employer program. Standard Part B premium is deducted from your Social Security if you're enrolled. If you're not enrolled in Social Security, then you have to make arrangements to have your bank account billed for your Medicare premium. So, special enrollment period, that's the second enrollment window. Those leaving active employment with large group health coverage after 65, this period is designed for people who delay Medicare due to employer coverage. The last 8 months from the end of employment or group coverage, whichever comes first, that's the window for your SCP coverage. Missing this window can result in penalties and delayed coverage. What documents do you require? Well, from CMS L564 from your employer is needed to provide creditable coverage. Your HR department should be familiar with this form and can assist you. Enrolling during SCP avoids the late enrollment penalty. It is crucial to gather all necessary paperwork to ensure a smooth transition. Then there's the general enrollment period from January 1st to March 31st of each year for late enrollees. This is the last opportunity to enroll if you miss other periods. Part A begins January 1st. Part B begins July 1st for GEP enrollees. This delay can leave you without coverage for several months. Late enrollment penalties assessed if you use GEP to sign up. The penalty increases the longer you delay your enrollment. GEP is a last resort for those who missed IEP and SEP. It is the best way to avoid this period by enrolling on time. So if you want to avoid late penalties, then utilize the initial enrollment period and the special enrollment period so that you don't have to rely on the general enrollment period and incur penalties. Now, if you're working past 65, there are things you need to know. You are eligible to delay Medicare without penalty if you're covered by a large employer plan. This allows you to maintain your current health insurance until you retire. Small employer groups, however, must enroll in Medicare at 65, even if you keep working. Failing to do so can lead to denied claims and permanent penalties. So, whether you are continuing to work at 65 or not, the insurance you can keep from your employer is based on the kind of employer you work for, whether it's a large employer or a small employer. If you work for a large employer, you can continue with your current coverage. If you work for a small employer, you are required to sign up for Medicare at 65, even if you continue to work. Medicare pays first. If you work for a small employer, employer plans pays second. Understanding this order prevents unexpected out-of-pocket costs. Rules apply based on whether you or your spouse's employer is small or large. Always verify employer size to determine your best coverage or course of action. Then there are health savings accounts. How do they factor into all of this? You cannot contribute to a health savings account after enrolling in any Medicare plan. Continuing contributions can trigger tax penalties and IRS issues. Stop HSA contributions 6 months before applying for Medicare Part A. This ensures you avoid retroactive Medicare coverage that could affect your HSA. Continuing HSA contributions after Medicare enrollment results in tax penalties. Planning ahead can help you avoid costly mistakes. HSA can be used for Medicare premiums and out-of-pocket costs. This makes them a valuable resource for covering healthcare expenses in retirement. But you just cannot continue to contribute towards it. Avoiding common mistakes. Number one, check your employer size. Confirm the number of employees before delaying Medicare enrollment. This simple step can prevent costly errors and denied claims. Retain proof of creditable coverage for future reference. You may need this paperwork if you enroll later or are audited. Compare employer insurance with Medicare to determine the best value. Each plan's costs and benefits can vary significantly, and consult a Medicare expert or advisor for personalized guidance. I'm about to share with you a Medicare expert organization that can help you as an advocate in your corner. So stay tuned as I wrap this up. Now, you can enroll in Medicare and change your mind. You can disenroll from Medicare Part B if you return to work with a large employer coverage. This flexibility allows you to adjust your coverage as your situation changes. You will need Form 1763 to stop Medicare Part B premium if rejoining employer insurance. Completing the form correctly ensures your changes are processed smoothly. Start planning at least 9 months before you want Medicare to begin, especially if using an HSA. Early planning helps you avoid penalties and coverage gaps. Regularly review Medicare rules and deadlines to protect your coverage and finances. Staying up to date, like watching this channel and implementing the tips that we're sharing with you, goes a long way. But of course, do your own research to validate everything you hear online to make sure that you're getting the right information. Now, I told you about our Medicare advocate. Chapter Medicare is our partner. We've been doing this work for 15 years. This is the first time we're recommending a Medicare partner because these guys are the real deal. What is the difference between Chapter and the other organization? They are advocates. Their main job is they want to make Medicare simple so that you can make the right choice and get the best out of your coverage. Now, if you call the number on your screen to talk to Chapter, which is free, it's a free resource to you, here's what they will do. They will show you every Medicare option that's available to you, including detailed information about which doctors, specialists, prescription drugs, hospitals that are covered, and what the copays cost, and how the plan that they're showing you all compared to traditional Medicare, helping you make the right decision. And these guys have tons of 5-star reviews, A+ rating with the Better Business Bureau. So I wanted to share one of these 5-star reviews that just happened recently. It was from Michelle S. I can't praise Chapter and Shannon Davis enough. Shannon's knowledge/professionalism and most importantly, compassion towards me in a very frantic situation was beyond words. Shannon treated me like family member and was able to keep me calm and minimum tears. After learning only 3 weeks ago, that my biopsy results came back positive for cancer and my current Medicare insurance wasn't going to be accepted at Memorial Sloan Kettering Cancer Center in New York City. To say I was devastated was putting it mildly, especially since I just moved here 6 months ago. Now, when you move, you have to change Medicare plans, especially Advantage plans, and had to get a new health insurance at this time. Shannon went above and beyond to find a new insurance plan for me, even though the window had been closed. I'm thrilled to report that as of April 2025, I was approved for a new health insurance plan that begins in May 2025. And with the help, it takes a village of many. I am now scheduled for surgery on May 9th. I hope it went well, Michelle. Bottom line, don't hesitate to use Chapter. You'll be happy you did. This is an actual person we referred that had an amazing experience, like the thousands of other people that have been referred and I've had amazing experience with Chapter. So call the number of yours on your screen, 539-205-2147. If you're turning 65, this number is for you. If you're already in a Medicare plan and you're not happy with it, or you think you could do better, or you're not even sure if there's a better plan out there, these guys will find it for you because a lot of Medicare plans are based locally, based on where you live. And these guys are the only organization that have access to all 24,000 Medicare plans. So they can see everything and recommend the best plan for you. Remember, they're advocates. They don't pay their agents to push specific plan. They are there to help you pick the best plan. So call 539-205-2147 or go to askchapter.org/insider. And as I said, a lot of 5-star reviews, like I read to you just now, an A+ rating at the Better Business Bureau, and they can save you $1,100 a year on average. And finally, go to our YouTube channel at the top of the description on our channel where our name is. There's a link at the bottom. Click there. You can sign up for our insider newsletter so that you will not miss any senior savings, senior discounts, breaking news that we share regularly on our newsletter to keep you informed. Sign up today or go to benefitsinsider.co/subscribe. If you like what you heard, hit the like button, hit the subscribe button. We really appreciate your support and your help to help us grow this channel from nothing to over 100,000 subscribers and growing. So we really appreciate you, and I'm looking forward to seeing you tomorrow on our next video. Thank you for spending this evening with me.